My name is Dr. Jadranka Stojanovska. I'm a cardiothoracic radiologist, an assistant professor of radiology, and director of cardiac MR program at the University of Michigan. Cardiac MR is my clinical and research passion because it provides personalized care to our patients as one-stop shop imaging. Therefore, I'm super excited about our upcoming virtual SCMR meeting, and especially our SCMR workshop on advanced cardiac MR of cardiac mechanics and hemodynamics towards individualized evaluation of cardiovascular disease, which will be live on February 18th. I simply cannot stress enough how much the value of knowledge, sharing, and caring for each other are important in this unprecedented times. In light of this workshop, I'm delighted to be joined by the two co-chairs, Dr. Kim and Dr. Schnell, whose work speaks for themselves. Dr. Kim is a professor of radiology at Northwestern University in Chicago. His research spans from technology development to translational science in cardiovascular MR. His research focuses on unmet clinical needs by developing new MRI pulse sequences and reconstruction methods and translating them to improve clinical management of heart disease. Dr. Schnell is a professor at University of Greifswald at Baltic Sea in northern Germany and an adjunct associate professor of radiology at Northwestern University. She runs the medical physics master's program at the University of Greifswald, and her research includes medical image processing workflow, and cardiovascular and neurovascular 4D flow MR. Despite their expertise in cardiac MR, they're amazing people to work with, and I truly enjoyed my time working with both on the committee. With no further ado, I will now turn the podium to our esteemed guests and ask them several questions. Dr. Kim, given your expertise in cardiac MR, can you please tell us what are the one or two most impactful new developments in your area in 2021 for the practice of cardiac MR?
I would love to, Jadranka. So I think the first area that I think that are really important is doing rapid free breathing scanning, because as you guys all know, cardiovascular MR, while it's fantastic, it is really, really slow. So I think it is important to try to accelerate the scans as fast as we can, get the protocols down from over an hour or about an hour down to 30 minutes or less if possible, and also make the acquisition free breathing so that it becomes very patient friendly, so that you don't have to ask 20 different breath hold acquisitions. Well, that's one area. The other area is the image analysis of cardiac MRs is really long, and you're asking highly compensated physicians to draw circles and do all kinds of analysis. So I think it's, if we can use the power of artificial intelligence to automate and really accelerate the analysis so that the entire workflow from scanning all the way down to data analysis, and if we can automate it, make it fast, I think that'll truly make a huge difference.
Thank you. Dr. Schnell, this will be a question for you. I'm very excited to be part of this year's SCMR workshop. Could you please share with us one or two take-home points from this year's workshop?
Thank you, Jadranka, also for your very kind introduction before. Yes, so what do I think? I think as methods developers, we are very often too focused on our methods we develop. So I think we should rather try and look at what the clinical questions really are, so that we can, at the end, find comprehensive approaches for those. So in this workshop, we actually tried to turn the questions around a little bit than we usually do, and not approach it from just the methods development side, but to actually ask the radiologists and pediatric radiologists, what are the clinical questions? What is the clinical need, rather than asking, what can we now do with our methods? So I hope we can achieve this, and that people can take this home and go back to their development.
Thank you. Dr. Kim, you are an accomplished scientist, and if you go back in time when you were junior faculty, what would be one piece of advice that you can share with our current junior faculty to embolden their journey with cardiac MR imaging?
Yeah, I think the first step is to make sure you attend SCMR. And then the other thing is obviously to really have a sort of a inquisitive mind, willing to learn, and not only just from fellow faculty, but also from our technologists and trainees and other clinical collaborators. So that I think if you have that attitude of like wanting to learn, advance ourselves, and constantly improve our capability, I think that is probably one piece of advice that I can give.
Thank you. I think that it's really a great answer. SCMR provides valuable support and immense opportunity to its members. Dr. Schnell, can you please share one piece of advice on how to get more involved with SCMR?
Yes, I think I think it is networking. Try to get to know people in the field. For example, as a woman, consider joining the CMR Women event, or get in touch with the faculty and try to get involved in committees, and to try to involve yourself, to bring your personality to the people and talk to them. I think that's the most important, networking.
Thank you. I also think, and I share your point of view, that networking is really, really important. So now we came to an end of our discussion, and I want to thank Drs. Kim and Schnell for sharing their insights of the future of cardiac MR. The virtual SCMR meeting is an opportunity to grasp and share new knowledge to embolden yourself and others for the benefit of our patients. Please come and join us. Thank you and have a wonderful rest of your day. Take care.